Hello, everyone. My name is Eddie White, and I am today going to show you some physical therapy treatment tips. Which is what this is going to be is just going to be me just going through, giving you instructions on how to keep certain part of your bodies healthy and how to keep them strengthened, and how to reduce injury risk for later on. So today's topic is going to be about shoulder impingement. You might be asking yourself, what is shoulder impingement? Well, shoulder impingement is just uh, for lack of a better term, the immobility of your shoulder, as in you can't go your full range of motion as you like to when you're going up or down. This sensation is going to be caused by the lack of subacromial bursa fluid, which is located right here on the acromion, which you can see. The acromion is located on the clavicle, which connects to the shoulder blade. And so, since there's no fluid in the subacromial bursa, which is located in between the acromion and the rotator cuff, it's going to cause a grinding sensation to happen, which is what will get you to have that stuck feeling whenever you go back and move your shoulder back. So, in order to test if you have shoulder impingement, what I like to do, or what other physical therapists like to do, test it by doing something that they call the picture test. So what you do is you just put your arm back like there, and you have someone grab your hand where the baseball is, and just pull back on it. So you're gonna be in the same position like that. Your elbow's gonna be 90 degrees, and you're just gonna have someone pull back on your arm and pull back as far as they can. And if they can pull back without any issues, you don't have shoulder impingement. But if they pull back and they're stuck, or you feel any discomfort in your shoulder, you do have shoulder impingement. So, in order to aid shoulder impingement, we have to target the muscles around the shoulder. Muscles that is actually really highly neglected is going to be the serratus muscles. Serratus is going to be located deep inside the shoulder muscles, so it's going to be deeper than the latissimus dorsi and deeper than the rhomboids. Here's another view of the serratus muscles. So what we do is we exercise all the muscles around the rotator cuff, so that way you can compensate for the lack of the subacromial bursa. This will not only strengthen your muscles, but it will also allow for more mobility at the same time. Of course, this mobility will not happen overnight. You will have to be treated with physical therapy and different type of treatments and stretches. One of the stretches that is often liked and used by physical therapists is the one pictured here. As you see, he's putting pressure on the back of his shoulder while at the same time pulling his arm back, getting the overextension and getting him to stretch out his latissimus dorsi, serratus, and his rhomboids. This will ultimately aid his movement in his shoulder and help his shoulder impingement. So it helps the muscle recognize that it can move farther than it can, and realize its potential mobility. You can also reenact this same motion and same stretch by just going to your house and grabbing on something preferably tall. Just reach up and then just pull your arm back. It will stimulate the same thing as if you were at a physical therapist and simulate that same stretch. If not, you can find someone who can help you do the same stretch as well. All you're going to do is just stretch to maximum tension. Do not stretch to discomfort, just stretch to maximum tension. And it will ultimately help you gain that mobility back slowly. So now we move on to the exercise. So next, the exercise. The exercise is called the serratus circles, and as the name implies, it targets the serratus muscles. So what do you do? Well, first you have to find a towel or a magazine or anything that can slide on the surface that you're using. You put it underneath your hand while in the posture position, and with the one individual hand, you will start turning it in a circular motion. And that's you're gonna alternate from counterclockwise and clockwise to ensure you get most out of the workout to strengthen the serratus. You will also switch arms to make sure you get the same mobility in both shoulders, so one is not lacking more than the other. With that, I have now went over what is a shoulder impingement, how to check for shoulder impingement, the muscles involving shoulder impingement, stretches that have to do with shoulder impingement, and an exercise that aids shoulder impingement. I hope you've learned a lot today, and I hope I was useful to you, and have a great day. Thank you for listening.